Hello and welcome to Science Deciphered, your source for evidence-based information on all things science. Today, we're going to talk about a topic that's often surrounded by myths and misconceptions: masturbation. Disclaimer: before we continue, we want to make it clear that masturbation is a topic that may not be suitable for all audiences. If you are uncomfortable discussing or hearing about sexual topics, we suggest that you stop watching this video now. Additionally, we want to emphasize that this video is for educational purposes only, and is not intended to promote or encourage any specific sexual behavior. What is masturbation? First, let's define what masturbation is. Masturbation is the act of sexually stimulating oneself to orgasm. This can involve touching or rubbing one's genitals, or using sex toys or other objects for stimulation. Having understood what masturbation actually is, now, let's discuss the pros and cons of masturbation. On the plus side, masturbation can help reduce stress and anxiety, improve sleep quality, and boost mood and self-esteem. It can also be a healthy way to explore one's own sexuality and preferences. On the minus side, excessive masturbation can lead to physical discomfort or injury, such as chafing or irritation. It can also lead to a decrease in sexual sensitivity or difficulty achieving orgasm with a partner. Moving on, let's debunk some of the most common myths about masturbation. Myth number 1: masturbation causes blindness. This is a popular myth that dates back centuries, but there is no scientific evidence to support it. While it is possible for excessive masturbation to cause eye strain or fatigue, there is no evidence to suggest that it can cause blindness. Myth number 2: masturbation causes hair loss. Similarly, there is no scientific evidence to support the idea that masturbation can cause hair loss. While some people may experience hair loss due to other factors such as genetics or hormonal imbalances, there is no evidence to suggest that masturbation plays a role. Myth number 3: masturbation causes erectile dysfunction. While excessive masturbation can lead to temporary erectile dysfunction, this is a rare occurrence and typically resolves on its own. In fact, masturbation can actually help men learn more about their sexual responses and become more comfortable with their own bodies, which can ultimately lead to better sexual experiences with a partner. Myth number 4: masturbation is only for men. This is a common misconception, as both men and women can engage in masturbation and experience pleasure from it. Masturbation can be a healthy and normal part of human sexuality for people of all genders. Myth number 5: masturbation is a sign of sexual dysfunction. On the contrary, masturbation is a healthy and normal part of human sexuality, and can actually help individuals become more comfortable with their own bodies and preferences. While some people may choose not to masturbate for personal or cultural reasons, there is no evidence to suggest that masturbation is a sign of sexual dysfunction. Myth number 6: masturbation is only for single people. Masturbation can be a healthy way to explore one's own sexuality, whether single or in a relationship. Many people engage in masturbation even when they are in a committed relationship, and this can be a healthy way to explore their own desires and preferences without putting pressure on their partner. Myth number 7: masturbation is a sin. As we discussed earlier, while some religious or cultural perspectives view masturbation as sinful or immoral, there is no scientific evidence to support this belief. Myth number 8: masturbation can make you infertile. This is a common myth, but there is no evidence to suggest that masturbation can make you infertile. Masturbation does not affect the production or quality of sperm, and it does not impact a person's ability to conceive. Myth number 9. Masturbation can cause cancer. There is no evidence to support the idea that masturbation can cause cancer. In fact, some studies suggest that regular ejaculation, whether through masturbation or sex, may actually reduce a man's risk of developing prostate cancer. Myth number 10. Masturbation is addictive. While some people may struggle with excessive masturbation, it is not considered an addiction in the same way that substance abuse or gambling can be. Masturbation is a normal and healthy part of human sexuality, and it is only when it interferes with daily life or causes physical discomfort that it may become a problem. Now, it's important to note that while we have debunked many myths surrounding masturbation, everyone's experiences and beliefs are unique. It's important to listen to your own body and make choices that feel right for you. Remember, masturbation is a normal and healthy part of human sexuality, and there's no shame in engaging in it. We hope that this video has helped to debunk some of the common myths and misconceptions surrounding this topic. Thus, we want to hear from you. What are your thoughts on this topic? Do you have any questions or comments? If so, please leave them in the comments section below. And if you enjoyed this video, please be sure to give it a thumbs up. Subscribe to our channel Science Deciphered for more evidence-based science content. See you in the next video.